our slides, but they will be back in just a moment. So basically during the erection process, the penis engorges with blood. And so the penis arterial, the blood flow in is what makes the penis firm and erect. And then that compresses the veins, which sit on the outside part of the penis, and that prevents the blood from returning to the body. So when we talk about blood flow in erections, what we're really talking about is the blood flow into the penis. That's what makes it firm and erect, helps the blood stay there by compressing the veins and preventing that blood from returning to the body. So erectile dysfunction can be caused by many different things. Most commonly, especially here in the United States, it's going to be due to either a problem with the blood vessels, as you can imagine, with blood flow. Diabetes has an effect on both the blood vessels and the nerve endings, and so has a high rate of erectile dysfunction. And then medications that some of us take can also lend into erectile dysfunction. In particular, tonight we'll also make special mention of prostate cancer treatment, because men that have undergone treatment for this can have erectile dysfunction or urinary leakage thereafter. So as you can imagine, you know, sexual health and sexual quality of life is extremely important to many different aspects of life. And so if this is suffering, you can have, you know, a decreased overall quality of life. And so that's why it's very important to find a provider that has a knowledge base to help you out in this area to get you back to your goals of where you want to be with your sexual health. So we're going to kind of divulge now into some more different groups of health issues that can have a particular effect on the erections and why that happens. So we're going to start off with diabetes. So diabetes is very common in the United States. About 15, probably more 16 million men at this point have been diagnosed with diabetes. And that's important because men with diabetes are very likely to have erectile dysfunction. In fact, 1 out of 2 men that has a diagnosis of diabetes will have erectile difficulties. This also becomes important because of when you're finding someone to help you out with your sexual health. Erectile function for diabetic men is not as responsive to some of the mainstay treatments like the oral pills. So why is diabetes related to erectile dysfunction? So diabetes affects both your nerves and your blood vessels, and the penis has a very fine network of both. So you think of diabetics complaining of neuropathy in their hands and feet, that same process is happening in the penis because of the fine blood vessels and the nerves. So that's where, if you can kind of remember that diabetics get that neuropathy in their hands and feet, basically the same thing is going to happen in the penis, and that's going to cause troubles with the erections. So other factors that can increase erectile dysfunction in diabetic men is age. So the longer duration that you've had diabetes, your sugar control. So you want to make sure that your A1C is as close to normal as possible. The microvascular complications, again, those fine blood vessels and nerve endings are so critical for healthy erections. And you might also have comorbidities or other medical diagnosis if you have diabetes, including cardiovascular disease or being treated with medications that can have effect on the erections. So men with diabetes are at higher risk for heart disease. And this becomes important because if a young man, you know, someone in their 30s or 40s comes to me and says, you know, doc, I'm really having trouble with my erections, my first response isn't to throw medication at them. It's to check and see, have they had their heart screening, their cholesterol screened, high blood pressure? Do they have a family history of early heart disease? Because the penis is actually a mirror of the heart. They're both vascular organs and they're both very dependent on blood flow. So if you have problems with your erections early, you might have problems with your heart later. So very important to use that as a screening process for your cardiovascular health as well. So kind of going along with this screening process, the erectile dysfunction can predate any difficulties with the erection, or I mean, excuse me, with your heart by 2 to 3 years. And within 3 to 5 years, there is a higher rate of significant events with the heart happening, such as heart attack or stroke. So you want to make sure that if you're having problems with the erectile function, that you've looked at the whole global health of, the body, especially the heart, to make sure that there's not any other systems that are suffering from vascular disease. So, why does this happen? We think about those fine arteries in the penis, and they're so much smaller than what we have in the heart. And so that's why you have the erectile dysfunction prior to the development of these more advanced signs of cardiovascular vessel disease. And it's all based on the size of that blood vessel. So you can improve the longevity of your erectile health and your heart health and your blood vessel health by doing healthy lifestyle choices. So, maintaining a good diet, reduce the salt, keep the blood pressure under control, keep the cholesterol under control, good physical activity, walking, cardiovascular exercise, get a, 20 minutes to 30 minutes daily if you can of just walking with a light sweat. If you smoke, quit. That can be one of the best things that you do for your overall health and protection of your erections. One cigarette will cause vasoconstriction or narrowing of those blood vessels for 7 hours after that one cigarette. Reducing stress is also a known factor for developing, chronic diseases later in life, and that can include erectile dysfunction. So let's talk about the correlation between ED and testosterone. So while testosterone can be low in men with erectile dysfunction, it has more impact on your libido, the sex drive, in that feeling of sexual activity. It has less impact on the blood flow of the erection. So it's common for men to have both low testosterone and erectile dysfunction, but it's not exclusive to each other. So you can have normal erectile function in low testosterone and vice versa. It's important that if you're symptomatic from low testosterone, which would include low libido, fatigue, fat gain, difficulty exercise, tolerance, then that you have your blood work assessed as well. So kind of talking about some of those signs and symptoms, fatigue, and difficulty with sexual interest, things of those nature can be indications of low testosterone. Also, feeling depressed can be a sign of low testosterone as well. So there's a bunch of different treatment options for low testosterone, and you can chat with your doctor about those options if your testosterone blood work comes out showing a low value. All right, so let's talk a little bit about prostate cancer. So in the treatment of prostate cancer, you can see here on this anatomic diagram that there's the bladder, the prostate, and the urethral sphincter. So this is going to come back to us when we talk about incontinence as well. But when we're looking at the treatment of the prostate, those yellow tubes that you see here in the picture are the nerves, the sexual nerves. And when you either do surgery or radiation, those nerves are very close to the treated area for the prostate cancer. So even if you have a perfect nerve spare prostatectomy, or where they preserve those nerves, because of the inflammation and injury, so to speak, to the area from surgery, you can still have changes in your erectile function thereafter. So after prostate cancer treatment, it is estimated that anywhere from 25 to 70%, 75% of men will have changes and decrease in their erectile function. I always tell men it will not get better after whatever treatment you have. And so it's a real important time to have a good look in the mirror and kind of assess where your erectile function is prior to your treatment. So after your treatment, you can have a gauge of where your erectile function may shake out afterwards, so you can get assessed with a specialist in terms of how to protect your erectile function, how to regain your erectile function, and if treatment options aren't working from the normal oral pills, what are some advanced options that may be available? Radiation also has side effect of sexual dysfunction. Again, because that radiation treatment is directed at the prostate, the sexual nerves are included in that radiation field. So Peyronie's disease and erectile dysfunction is Peyronie's is the development of scar tissue within the penile tissue, and that scar is not flexible or pliable. So when that scar tissue forms, you get a point of curvature because the rest of the erectile tissue is spongy and expands with an erection, and so you get this engorgement and stretch, and the scar is fixed and tight, and so the erection will curve towards the point of the scar. This can cause problems with inability to have sexual intercourse from both decreases in erectile function or just from a mechanical standpoint. The curvature prevents penetration and can make it difficulty to maintain an erection. So if you've had an onset of curvature or painful erections with curvature, feel a lump in the penis, make sure you make an appointment with your urologist to have that checked out. So signs and symptoms of this, as I said, painful erection, curvature of the erection, a lump in the penis, a decrease in your erectile function with any of these symptoms, or shortening of the penis can all be signs of Peyronie's disease. So treatments for Peyronie's disease can be a medication called Xiaflex, which goes an injection into the scar tissue or the plaque to help soften that, and that is done over a course of total of 24 weeks. Another option is for surgery, and there's several surgical options for this. Either stitches to kind of pull it back towards a straight location, excision or grafting, which is for the more severe 90-degree or more curvature, or penile implants, which correct both the Peyronie's disease and erectile dysfunction if both are occurring at the same time. So restoration treatment options. So what can we do to help retrieve erectile function and make it better? You want to talk with your medical team. So you can start with your primary care. If the primary care has tried, pills and that's not working, or find a urologist if you have any medical comorbidities such as Peyronie's, diabetes, or cardiovascular disease that might require a little bit more advanced treatment of erectile dysfunction, or a prosthetic urologist, which myself would be included, someone that specializes in both the treatment of erectile dysfunction and surgeries that can correct it. So we're going to kind of go through this menu option of treatment options. So oral medications are where most men start. These are the least invasive and can have good effect for many men. And so what these do and how they work is they vasodilate or increase the caliber of the blood vessels so blood can flow into the penis, creating a firmer erection and help with maintenance for some men, or the longevity of the erection. You do have to take the pill and then have normal sexual stimulation. It's not like you take the pill and then it just pops up. You do need still that normal stimulation process. Take it about an hour before anticipated activity. Depending on whatever type you take, it can last for 4 to 36 hours, depending on the type. Neither one of Cialis or Viagra is better than the other one. Men have different responses to each medicine, so whatever works better for you, it's worth trying one and the other to make assessment of that. Don't take it more than once a day. That can lower your blood pressure. And some common side effects that can happen with this are going to be headache, facial flushing, stuffy nose, and upset stomach. So most important with this medication is if you have any heart problems or cardiovascular disease and you're taking a medicine called nitroglycerin, you cannot take these medicines called PD-5 inhibitors or Viagra, Cialis, Tadalafil, Sildenafil. Okay, that can cause a serious and sometimes fatal combination. So make sure you let your doctor know. So the vacuum erectile device, I often pair this with other erection treatments. So either with oral therapy or injection therapy, which we'll talk about in a minute. But basically what this is a mechanical creation of an erection. So it's a vacuum tube that goes over the penis, it pulls suction, pulls the blood into the penis, creates a hard erection, and then you put a constriction band at the base of the penis to hold the blood there. I also recommend this for men that have had treatments with prostatectomy, so they can help, I call it yoga for the penis, so they can help stretch the penis, give that gentle stretch to the penis for about 5 to 10 minutes every day. That helps bring blood flow to the tissues, very healthy for the tissues, helps give that gentle stretch and can help regain length for some men that have lost length, either from erectile dysfunction in general or from previous prostatectomy or radiation treatments for the prostate. Side effects of the vacuum device, especially if you're wearing it with the constriction ring, are just going to be constriction-based problems where you have blocked ejaculation. Bruising of the penis, very uncommon. You have to really pump it up for that to occur. Penile discomfort and numbness or coldness can occur because essentially what you're doing is you're creating a tourniquet effect. So the urethral suppository, I'll be honest, I don't recommend this one very often because it can cause some pretty significant burning at the head of the penis. But what you're doing is you're putting in a little tic tac shaped medication that goes into the urethra, and then that absorbs into the local tissues, creating the erection. It's most commonly causes that burning sensation, like I said, but can help give engorgement, especially to the head of the penis for men that are noticing that they're not getting a full erection at the head of the penis. So intracavernosal injection therapy, or shorthand ICI, this is going to be another common form of treatment options for men that are not responding to medications. So this has a more potent medication that you inject into the side of the penis. It has an effective rate in about 60% of men were satisfied and continued their use. It does have a high dropout rate because, as you can imagine, having to go to the fridge, get your medicine, draw it up in a syringe, step into the bathroom, give yourself an injection. Men, have a short uh, time span which they're willing to do that in many cases. But for some gentlemen, this works excellent and can be a long-term solution. The most common side effects and things that I care about are going to be priapism, or an erection that lasts too long. Anything more than 3 hours, your blood is not exchanging in the penis and causes ischemic injury, which is the same thing as a tourniquet. So you want to go to the emergency room if you have an erection that lasts more than 3 hours. Some discomfort in the penis with this injection can occur for some men. And then formation of scar tissue can occur for some men. It's unknown who it's going to happen for. But if with injection therapy, you do it towards the base of the penis, if you start developing curvature towards that site of injection over time, or feeling of a plaque, that can be an indication of scar tissue disease. So the penile implant. The penile implant is considered the permanent correction for erectile dysfunction. Once this implant is in place, you will always have a on-call or on-demand erection whenever you want. It's going to last as long as you want, and it is created by no longer relying on the blood flow of the body to create the erection, but instead there are 2 cylinders that go down the shaft of the penis, a pump that's in the scrotum, and fluid is translated from a pump into the cylinders. And we'll watch a video about how that happens. About 98% of patients that undergo this procedure say that they are satisfied or have excellent outcomes afterwards. And about 7 years afterwards, 94% of those men are still using their implant and free of revision. So we're going to talk about this one a little bit more, but just to kind of talk about side effects, it is a surgery, and so we have to make sure that you're an appropriate surgical candidate. It is a mechanical device. We expect it to last anywhere from 8 to 12 years on average. Infection is the complication that I care most about because even though it's rare, about 1% of gentlemen, it does require to have an additional procedure thereafter to help treat the infection, which can include repeat surgery. So things to know about prior to undergoing this decision. So we have 3 different implants that we'll talk about tonight. In particular, I'm going to focus on the the third one we see here, that's the inflatable penile prosthesis. The first two I use in select gentlemen with appropriate indications. So the AMS 700 implant is coated with an antibiotic, so to help prevent infection. And what it does is it goes in the penis, the cylinder part goes down the shaft of the penis, the pump, which is this little grenade looking thing here, sits in the scrotum, and the reservoir sits behind the pubic bone. So I have a lot of men that come to me and they talk about, doctor, can you make my penis bigger? Can you make my penis longer? Now, my personal feeling on this is I never promise that there will be a change in size. And I think that's very important for men to know. Anytime we do surgery, you can have formation of scar tissue after surgery, and that can restrict the length of the penis. Erectile dysfunction in general, you can have up to a ½ centimeter of length lost from the penis just from years of not having appropriate or normal erection cycles. And so your penile length from the last time that you saw a full erection to the time that you might choose to undergo the penile implant might have been years. And so during that time, the penis might have atrophied or lost length just because of not having that natural erection process. So, many men are concerned about their length and their girth and things of that nature. We do what's called a stretch penile length, and you can do it at home. You stand in front of the mirror, grab the head of the penis, pull it straight out from your body, so you're kind of looking from the side, and where you feel that maximum point of tension of the penis pulled straight out from the body, you look down, and that's your stretch penile length. That's what you can expect to see after the penile implantation is done. The girth does in fact expand for many men after this procedure, but again, not something that I would ever promise to a patient, but is the experience of many men after the surgery. All right, so we're going to watch a little video here about what's going on with the implant. All right, so here in the penis, you see the two yellow cylinders, and the gentleman is pumping in the scrotum. This is all concealed with under the skin, so if he's at the gym, you won't see anything. The fluid is being translated from the reservoir, which sits behind the pubic bone, into the penile shaft. When he is done with sexual activity, he hits a release button that returns the fluid from the shaft back into the fluid reservoir, and the penis goes flaccid again. So most importantly, men ask if they have, are people going to know if I have this? Is, my sensation going to be the same? And there should be no change in the sensation. So your orgasm should be the same. If you're at the gym and undressed, the only person that's going to know you have the implant is you. For sexual activity, it's an on-demand erection whenever you want. It will last as long as you want. It will not go down until you release. So even when you climax, your erection will maintain until you release, which is different from your natural erection. So important to know about. And, when we're looking at satisfaction with this implant, you can see, very high rates of both patient and partner satisfaction rates, which, is an important marker. You want to be satisfied if you're going to go down this route. So kind of going over the risks and benefits, I talked about a lot of these. On demand, lasts as long as you want, high satisfaction rate, no change in your sexual sensation, your orgasm stays the same. These implants have been around for 40 years. And actually, the surgeon that trained me, Dr. Raphael Carrion, his father was the man that invented one of the first versions of the penile implant. So Hernan Carrion is his name. So, and there's over 500,000 patients that have been treated with implants over the years. So I get a lot of questions, is this covered by insurance? The vast majority of patients are covered by insurance, but if you're running into issues, there is going to be, some financial options that can be out there. So don't let that stop you if this is an option you feel would be good for your sexual health goals. But the vast majority of insurance covers. So there is Veterans Choice programs. Basically, if you're part of a VA and you don't have a specialist there, you can go to the community and find a physician like myself that would be more than happy to take care of you. So like I said before, it is a surgical procedure. We do have to make sure all safety parameters are met. Most importantly, that you're a safe candidate for anesthesia. And then above and beyond that, risks particular to the penile implant, the one that I care most about is infection. 1%, 1 to 2% of gentlemen that undergo this procedure may end with infection. Should an infection occur, we do remove that device. Just like a hip or a knee, you can't leave something infected that's foreign in the body. So that does need to be exchanged for a new implant. And that can either be another malleable implant or inflatable implant or a malleable implant. So in summary, from the erectile dysfunction side of things, it's very common. About half the men with diabetes and 40% of men over the age of 40 will have erectile dysfunction. There's many treatment options available out there. So please find a healthcare provider to be an advocate for you and help you in your goals of achieving the sexual health that you're looking for. So we're going to switch gears and we're going to talk about urinary incontinence, particularly stress urinary incontinence for men. So what happens with stress urinary incontinence is a laugh, cough, or sneeze, or you change your position, you're walking around, you're playing golf, and all of a sudden, gush, urine comes out. So it's up to 50% of men will have leakage following prostate cancer surgery, but most of those men are going to heal and have regain of their continence over the next couple months after surgery. But for some men, they never regain fully over their continence, and about 9 to 16% of men may have persistent symptoms of stress urinary incontinence for about a year after surgery. So this is a common problem with about 500,000 men having some leakage of urine with these stress maneuvers. So just a quick overview, looking at the side of this man here, we see his bladder at the top, prostate next, the sphincter, which is your urinary control just below, and then the urethra, which is the tube the urine comes out. So you can imagine if the prostate is treated for prostate cancer with either removal of the prostate or radiation treatment, the sphincter, the urinary control, which sits right below it, is immediately right there. And you can imagine that when the urethra is reconnected from the sphincter to the bladder, you can have some inflammation and dysfunction of that sphincter. So that is what helps you stay dry and keeps you continent. And so there is a recovery period after treatment for prostate cancer in which you have to get that muscle strength back up, and that muscle sphincter has to heal itself before you can regain your continence. So again, about that 9 to 16% will have persistent leakage after their prostatectomy. But there can be other reasons that this happens: neurological issues, prostate surgery for enlarged prostate, radiation. Especially the further out you are from radiation, the higher chance you have for leakage or forms of trauma. As you can imagine or know, if this happens to you, this can be a huge factor on quality of life, not wanting to go out in public, looking for bathrooms, making sure that you have Depends. And so just to know that there are treatment options out there, I think is very important for men. All right, so kind of going back to this same diagram as I promised, again, you can see where those nerves in the prostate, and now you know where that sphincter is located just below, and why after a radical prostatectomy or surgery to remove the prostate can cause leakage of urine after the procedure and some recovery time to regain that continence. So it is considered very normal and expected to have leakage after your prostate surgery, and it often comes back over that first year, but not all patients regain their continence. So now we're going to talk about a little bit of some of the things that we can do to help maintain being dry. So again, find someone that knows what they're talking about with their incontinence. So a urologist or a prosthetic urologist, someone that specializes in doing AUS or sling surgeries. So kind of this is what I call the Band-Aid treatments. The behavioral modifications, I never recommend to reduce your fluid intake. You need to hydrate. It's important for your kidneys and bladder. So keep going with the hydration, but you know, taking a bathroom break on a set schedule, not allowing that bladder to get too overfull is very important. The most important thing here, and not a Band-Aid treatment, but very, very important, is your pelvic floor physical therapy. Start this if you haven't undergone your prostate cancer treatment and have been diagnosed, start this before your treatment. So I wish everyone got that message, but it hardly gets across. The stronger your muscles are prior to treatment, the quicker your recovery is after treatment. You can talk with your surgeon, you can talk with any urologist, or you can find pelvic floor physical therapy exercises online. Coping treatments, these are more the Band-Aid things, pads, diapers, catheter, last option, or penile clamp, which is not the funnest thing for men to have to wear. So these Band-Aid treatment options, they're expensive. They cause a large burden of waste in the environment, and they're socially awkward, you know, always having to wear a diaper. So long-term treatment options and things that can cure or correct the continence to get you what we call socially dry, which is needing on average one pad per 24-hour period for just a couple of drips that might occur with high levels of stress. The male sling basically supports the urethra in a way that the musculature did prior to surgery. This is going to be great for men that have mild amounts of leakage. And then the artificial urinary sphincter is designed to replicate that external sphincter that sits right below the prostate, and it opens and closes on your demand. So the advanced male sling, this is a procedure that is going to support the urethra to give back those continence, and it has high patient satisfaction. 94% of men recommend this to a friend, and the recovery time for this is quite quick. There's no maintenance to this because there's no mechanical parts. So once it's in place, that's usually it for most men. So it's minimally invasive. So just a small incision in the space between the testicles and the anus is made. That's only about that long. It's very discreet. No one would know you have this. Your normal activities, depending on who you get your surgery with, are going to be resumed after about 2 weeks of activity. You just want to be careful with no bending, squatting, or lifting anything heavy in those 2 weeks in particular. The AUS is going to be a mechanical device. This is one that you control. This has, again, been in clinical use for over 40 years. This is a treatment very good for men with moderate to more severe leakage or have had a history of radiation treatment in their pelvis. Basically, what you do for this is there's the control pump you can see that sits down in the scrotum. You give it a squeeze, it opens the cuff just like your sphincter would to let the urine flow, and then it has basically a pressure mechanism which closes back up slowly over time, and that's going to create your dryness. So here's a video of that exact thing. So again, nothing is visualized from the outside. This is all discreet and under the skin. You're going to see him reach down. He's going to hit his pump, that is going to let the fluid exit the cuff. The cuff is going to expand so the urine can flow. And then the cuff, after the bladder is emptied, is going to squeeze itself back off and make you dry again. So again, very high satisfaction rate. I would say the patients that I see most eagerly in my office are men that have had this system for many years, and then they, it is a mechanical device. Eventually it will need to be replaced, and they cannot wait to have their new device placed. So this is going to benefit the men that have more significant leakage, mild or moderate to severe. They have a history of radiation in the past. Again, it's undetectable, has very high satisfaction rate, and really can renew confidence is probably the main thing in your normalcy of your life. So, if you've been dealing with urinary leakage, there's definitely options out there above pads and catheters and things of that nature. So please speak with a urologist, and keep a journal of your leakage to help us assess how much is occurring, and then go to fixincontinence.com to find a provider near you. So, again, talking about risks, the male sling, the sling can essentially, it slips out of position from when it's initially placed. Most commonly, this is going to be from a positional movement, either squatting, bending, or something that loosens it a little bit immediately after surgery. Urinary retention means that it worked a little too well. You can't pee afterwards. That is also extremely uncommon. Postoperative pain can happen. Again, not common, and that typically resolves within a couple weeks after surgery, should it occur. And then foreign body response just means that because it is a foreign material in your body, you can have an inflammatory response to it. Again, that's very uncommon. The urinary sphincter, it's a mechanical device, and so you can have mechanical failure. The average lifespan of these artificial urinary sphincters is going to be somewhere on average anywhere from 5 to 7 years. I would say more towards the 7-year mark. Erosion of the urethra and the cuff area. This can occur especially for men that have had a history of radiation. Those tissues are just not as robust, and because this cuff keeps a clamp on the urethra, you can have some wear of the tissue over time. Should that occur, the device is removed, you're allowed to heal over the next couple weeks, months, and then a new device is placed. Urinary retention, again, extremely uncommon with this device because it opens and closes. Infection can occur because this is, again, a foreign device going inside the body, and so we want to be very careful with how this is placed. Definitely find someone who specializes in this procedure to help reduce infection rates, just as you would for the penile prosthesis. Again, this is very well covered by insurance. I have hardly ever seen difficulties with insurance coverage over the years. So, there's options for your doctor's office to kind of work with you on this. Again, the veterans program, if you're a vet and they don't offer this at your VA facility, you can go into the community and find someone that can help you. So the most important thing to know is stress incontinence, can happen to men after their prostate treatment for prostate cancer, and there are treatment options. You do not have to live in pads or diapers for years and years. Definitely talk with a specialist about this to see if one of these two options would be appropriate for you. All right, so now we are going to transition over to two folks that are very near and dear to my heart. We have patient advocates, Mr. Stephen and Miss Deborah are going to chat with us about their experiences, and I'm going to hand it over to them.
Okay. So am I unmuted now?
You're good to go.
Okay, great. Thank you. Still getting used to this. My name's Steven. This is a journey